I find there's a lot of women that have regret. Huge moral question for you all. Is it reasonable to insist that a doctor perform a procedure that the doctor doesn't necessarily agree with or believe in? Here's a scenario. I recently posted on a colleague's page where she was reviewing a case where a young woman had had her tubes tied. And I said, well, I don't actually tie tubes that young because I find there's a lot of women that have regret. In my practice, I see it day after day, women that come in who tied their tubes in their young 20s and then had regret because now they finally realize they either need a tubal reversal if they still have their tubes, or that they need to have IVF done, and it's very expensive and or invasive, and the tears are streaming because they either can't afford it or they don't want to go through all of that just to have the child that they now want because circumstances changed, they have a new partner, they want more children, whatever the reason is. And I thought it was kind of a positive thing. I'm trying to preserve women's choice. Turns out I was wrong because many women said I'm infantilizing women and I'm treating them like children and I'm not respecting their autonomy. And my question is, well, in my practice, I see the opposite. I see all the regret and all the lack of information and the lack of informed consent. So I kind of say, I don't want that to happen to my patients. I'd like to protect them, give them any kind of alternative as long as it's not irreversible. There's all sorts of choices, whether it's medical or IUD or whatever you want, that can provide you with the same level of efficacy, but not a permanent solution. And that way, if they change their minds, they can easily reverse it. Instead of getting a positive response to that, I got absolutely flamed. So my question is, can patients demand, which was what all these women were saying, that a physician perform a procedure that the physician doesn't want to, whether it's based on their moral values or their beliefs or their experience?